Progress.
Welcome, everyone. Thanks for joining us. Let's just give people just a few more minutes to come into the screen, and we'll get started. Glad to have you all. Welcome. I got a few more people joining us. We're glad to have everyone today. We were just talking about how COVID is just everywhere, including our president of the United States today. So, as Peggy says, everyone wear your mask. Okay, looks like we're ready to get started. And good afternoon, everyone. My name is Jocelyn Travis, and I'm chair of our Ohio Equity Team. And on behalf of the Ohio Equity Team, I want to welcome you to our Environmental Justice Speaker Series. The theme of this monthly event is Equity as it relates to environmental justice and climate resilience. The Ohio Equity Team is a committee of the Ohio Energy Table with support from REAMP. Our goal is to encourage Black, Indigenous people of color, BIPOC, to become more engaged in issues of the environment. We are so excited to have our today's speaker as the phenomenal Almeta Cooper, who will be introduced by Tracy Sabata. Thank you so much for your support.
Thanks, Jocelyn. Today, I have the privilege of introducing my colleague, Almeta Cooper, National Manager for Health Equity for Moms Clean Air Force. Almeta lends her expertise in health equity and environmental justice to all aspects of Moms Clean Air Force work, with a special focus on the Community Health Equity Program. Her work on clean air and climate justice issues for moms is a natural progression of her 30-year career as an executive, attorney, and advocate for organizations focused on healthcare, health equity, and women and girls. Almeta moved to Atlanta to serve as the General Counsel and Corporate Secretary for Morehouse School of Medicine, where she managed MSM's legal affairs, served on the executive leadership team, and served as the Corporate Secretary for the Board of Trustees. Almeta has lived, worked, and served communities across the country, including some time here in Ohio. Since 2019, she has offered executive consulting services to nonprofit organizations, small businesses, executives, attorneys, and corporations. In 2022, she was selected to join the Multisector Partner Group of the Association of American Medical Colleges, AAMC Center for Health Justice. Almeta's work with Moms Clean Air Force was recently featured on the Today Show, on the Weather Channel, and in numerous other outlets, and she looked great. Almeta believes in being actively engaged with her community. She serves on several nonprofit community and healthcare boards and volunteers with civic groups, all between staying connected with family and friends across the country and enjoying some yoga sessions. With that, I will turn it over to my friend, Almeta Cooper.
Thank you, Tracy. And thank you for, I don't think I've ever had the word phenomenal associated with my name before, so I'm feeling very special right now.
You should insist on it at every opportunity.
Well, Tracy, if you would share your screen, and I'm going to be using some PowerPoints to kind of prompt me in the discussion today, and we will get started with that. So today I wanted to talk about connecting the dots between climate and health equity. And I appreciate being given the opportunity to be with you all and to be with my colleague, Tracy Sabata. Next. So one of the things that people use a term, but it's often not very well understood, is the term health equity. And what I currently do is serve as the National Manager for Health Equity for Moms Clean Air Force. And a part of my mission and part of my job is to make sure that we fully integrate health equity into all aspects of what we do. But that goes back to, what exactly do we mean when we're saying health equity? Well, It's not a new term, although I think in the last couple of years, we've heard it more generally and in the public. A physician and researcher and public health leader named Kamara Jones is credited with being the first person to really bring the term health equity into the common language. And her definition is really a straightforward one. And it's the one that I often use when people ask me about what health equity is. And what she says is that it is the assurance of the condition of optimal health for all people. So I'm going to share some other definitions that are a little more fancy, a little more complex, maybe a little more nuanced. But as we're talking today, and as you have questions, think about health equity from that very basic concept, the assurance of condition of optimal health for all people. And the other thing that might help you as you visualize health equity is to not mistakenly think that health equity is the same as health equality, because health equity means giving people what they need when they need it, not giving everyone the same exact care. Next. So subsequent to the time that Dr. Kamara Jones introduced the term health equity, Dr. Paula Braverman, who's also often quoted, introduced this definition, and saying that health equity is the principle underlying a commitment to reduce and ultimately eliminate disparities in health and its determinants, including social determinants. Just very briefly, social determinants really affects things such as where you live and access to healthcare, and whether you have adequate education, whether you live in a community that perhaps doesn't have good resources. And that's often referred to as the social determinants of health. You'll see it abbreviated as SDOH. But those are factors that enter into how people's health is really determined. Next. Here is another definition. Health equity means that everyone has a fair and just opportunity to be as healthy as possible, and this requires removing obstacles to health such as poverty, discrimination, their consequences, including powerlessness, lack of access to good jobs with fair pay, quality education, housing, safe environments, and healthcare. So that's what I was just talking about when I referred to the social determinants of health. So this is a broader definition that really clearly states these other factors that are impacting on health equity. Next. And then this fourth definition, which was from the 2020 Healthy People Report, is that health equity is the attainment of the highest level of health for all people, and achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. So I just want to pause for a moment and say to you that language does matter. Understanding what health equity means does matter. And if you have an interest in really taking a deeper dive into this whole issue of vocabulary and narrative, there's an amazing publication that is from the American Medical Association. It's been out for about a year. It is called Advancing Health Equity, A Guide to Language, Narrative, and Concepts. It's a very comprehensive document. It's a bit lengthy and goes into great detail, but if you really want to look in a very an in-depth way at why language is so important and different words that we sometimes use in our work involving health and health equity, I really want to commend that that guide to you from the American Medical Association. You can find it by going to the AMA website and just simply putting in guide or narrative for health equity. Next. So since I have been working with Moms Clean Air Force, and I believe most of you know that Moms Clean Air Force is a national organization of about 1 million moms, dads, caregivers who are really focused on clean air and children's health. One of the things that I did in 2021 is that I moderated a panel related to the human connection between climate and health. And from that initial panel, we decided at Moms to do a year-long series of panels related to climate, clean air, health equity, and inequity. And one of the first panels that I did was one that was right here in Ohio with my colleague, Tracy Sabata. And on that panel, we were very fortunate to have Congresswoman Joyce Beatty, State Representative Paula Hicks Hudson, Katrina Blassingame, a super mom and community leader. And we talked and focused on a lot about what's happening in Ohio, but also focused on children and Black maternal health. Dr. Arthur James, who was on that panel, is an obstetrician, gynecologist, and pediatrician who's done extensive work his entire career, which has been mostly here in Ohio, on this important topic of children and Black maternal health. And what you see on your screen are some of the very just disturbing and alarming facts that he shared with us in that panel. And by the way, if you want to go back and see this panel in part or in whole, you can just go to Moms Clean Air Force, put in Ohio, or you can go to the Ohio page of Moms Clean Air Force, where you can read more about all the great work that Tracy is doing, but you can also access this panel that we put on earlier this year. So climate and health, I just want to also say what we have learned this year, and we've seen it in global reports like the ICC report and the Lancet Medical Journal report from Great Britain, that healthcare has been determined to be the #1 crisis as related to climate impacts. So what we also know is that for frontline communities, Brown and Black communities, that they experience disproportionately the impacts, the adverse impacts of climate change. And therefore, and the most vulnerable populations are children, pregnant women, and the elderly. And elderly is generally described to be those who are 65 and older. So when we were having our conversation about clean air, climate, and health equity and inequity, we really focused a lot on children and Black maternal health. So again, looking back to what you see on your screen, nearly 700 women die yearly from pregnancy-related causes, and Black women are 3 times more likely to die from a pregnancy-related cause than white women. We talked just a moment ago about the social determinants of health, and those are some of the reasons that contribute to this terrible result. But air quality, air pollution also has a direct impact on the health and birth outcomes of mothers and children. And again, Black people are disproportionately harmed by poor air quality. Brown and Black people actually are disproportionately harmed by poor air quality and by air pollution. And most of us, and until I became involved in this work, I myself did not make that connection. I knew that air quality does affect how you feel. And the American Lung Association, and again, I commend to everyone who's here today to check out the American Lung Association State of the Air report, which is put out annually. And unfortunately, in Atlanta, where I live, every year we receive an F. And that's not very, doesn't make you feel very good to know you live in a city where consistently the air quality is an F. but it does give you an idea of, and motivates, at least motivates me to think about things that I can do, action steps that I can take and encourage others to take so that we can change that. And then being reminded that children, pregnant women, and the elderly are even more affected by this poor air quality. Some of the factors that also impact on this is the fact that Black and Brown communities tend to live nearer to pollution sources, plants, factories, and near highways where there's a lot of high traffic and therefore pollution, tailpipe pollution coming from trucks, buses, and automobiles. Next. So Dr. James also shared with us information about the infant mortality rate. And again, what you see on your screen is kind of a good news, bad news a set of information. And that is, the good news is that the infant mortality rate in the US has been decreasing, but unfortunately it's not decreasing on the same level or rate for Blacks, Native Americans, Alaskan Natives, and Native Hawaiians or other Pacific Islanders who are still dying at 2 times the rate of white infants. So, one of the things that we would hope is that we can work to eliminate some of these disparities. And part of doing that is just knowing the facts. At Moms Clean Air Force, and I want to emphasize this, is that one of the reasons why I am so proud to be a part of Moms Clean Air Force is that we really focus on getting information out in an accessible way and taking action in communicating with elected officials and making sure that as many people as possible have the information they need to understand the connection between, in this case, we're talking about the connection between climate and health. Next. So another panel that we had conducted this year was based in, kind of focused on Georgia. And on that Georgia panel, we also had local elected officials, a physician, and a local mom to give that personal perspective. Because what we have found, and it's not specific just to Moms Clean Air Force, is that real people are affected by climate. And we like to always have a person, a mom, sometimes a super mom from a Moms Clean Air Force, who can personalize and talk about her experience and how it affects her, her children, her family. And we have found that to be a very effective tool. So when we were talking about climate and health equity, we focused on Georgia, but also the and beyond relates to the fact that we also wanted to communicate that these experiences were not really limited to Georgia. So again, what we have found in Georgia and what the EPA has reported is that although right now Georgia is hot, and right now the whole country is hot, but we have had 20 dangerously hot days a year on average, but by 2050, that amount of days is going to increase to 90. That is a significant change. And as someone who lives in Atlanta, I can tell you, when you have that many consecutive hot days, it really impacts everyone. And in Georgia, like in Ohio, we have all types of geographic locations. So we have urban areas like Atlanta, we have suburban areas, and then we have a very large part of our state that is rural or focused on agricultural economies. So the impact on the state is such that if we continue, and we are likely to continue on this path unless something is done dramatically different towards the increased temperatures and warming, we have even been informed that our state symbol, the Georgia peach, they're going to have to find a new variant of Georgia peaches, because the peaches that we have now require a part of their growing system to be somewhat cool. And with global warming occurring the way it is, and this increase in temperatures, the Georgia peach, as we know it today, will not be able to tolerate this higher temperature. So it's not just cities that are impacted, it's also our agricultural economies. And I keep saying this, but African-American communities are often exposed disproportionately to environmental risk. And what we want to do as part of MOMS is to make sure that these communities, Brown and Black communities, are informed of risk and given resources or taught how to take action. Next. One of the points that's on this slide is another point that I want to emphasize to our audience, and that is, it is very important that we are each individually responsible. Yes, we should recycle. Yes, we should ride a bicycle or walk or be mindful of how we use our vehicles. Get an electric vehicle if possible, and we'll talk about this later, but also advocate for electric school buses. But what is very important, in addition to our individual action, is also collective advocacy, because that is what is necessary to change polluting systems. And we encourage you to communicate with your elected officials at every level, your local officials, your state officials, and your federal elected officials, to let them know how important it is to you that we have clean air and that we have adequate access to health, particularly, again, for Brown and Black communities. One of the barriers to being able to effectively address the connection between health equity and climate is the fact that we are still in a fairly early cycle of educating our health professionals to understand the connection. So not only do individuals not have the information, not make the connection, but we don't yet have a comprehensive strategy and approach for our health professionals to understand the connection. So I encourage each of you in the audience, the next time that you visit a health professional, your physician, or anyone who's providing you healthcare services, that you ask that person, how do climate changes in our community affect my health conditions? So, for example, if you have cardiovascular disease, there's a known link between higher temperatures and cardiovascular health status. Another fact that we are learning is that just the mere fact that it's hot outside could impact the effectiveness of your medication. So that's a question that you would want to ask your healthcare professional. So again, these are factors you may not have thought of. Next. Our most recent panel was Health Equity in Indigenous and Tribal Communities. And we were very fortunate to have with us Dr. Lori Byron, who is a physician who has spent about 3 decades working with the Indian Health Service, working with tribal nations. We also had Gregory Minthorn, who is a member of the National Tribal Association and a member of the Umatilla tribes. And last but not least, we were able to have our colleague, a colleague of Tracy and mine, Shayna Oliver, who is a mom and a member of the Navajo Nation and a very strong advocate for Indigenous people. It's just very concerning that generations of systemic abuses of Indigenous people has led in many places to chronic poverty, poor health care, substandard housing, and inadequate protection from pollution. And as I have mentioned before, that there are direct connections on health and poor air quality and pollution. Indigenous people have higher rates of diabetes, asthma, heart disease, chronic obstructive pulmonary disorder. And all of these are made worse by climate change. Next. Another factor that really is a correlation between this poorer health status is the fact that, surprisingly, Indigenous people are more likely to live within a half mile of oil and gas facilities compared to the rest of the population in the states where they are residing. When I think of Indigenous and tribal communities, and I think of particularly communities out west, I think of, beautiful, wide open vistas. But unfortunately, what we're seeing is that in these communities, they do have many of these oil and gas facilities. And now, unfortunately, it's been discovered that lithium, which on one hand is a positive in terms of electric vehicle batteries, this is a necessary element, has been found to be on lands adjacent or within what we would traditionally think of as Indigenous and tribal communities. So there's quite a concern about how is this going to play out to make sure that there's adequate protections, especially as the health-related aspects of being so close to mining operations or close to oil and gas facilities. One of the facts that I became aware of in doing this program, moderating the program on Indigenous and tribal communities and clean air and health equity, Tribal Association, which is comprised of more than 140 tribes, and they're really trying to drive policy change and achieve equity and to make their communities more aware of these connections between health and air pollution. Next. So on July 26th, we have our next program, which will be launched on July 26th at noon. I'm very excited about it. It focuses on extreme heat and Latino communities. I have learned how to say that title in Spanish. I'm not a Spanish speaker. Unfortunately, I have not taken formal Spanish, but it's protegiendo a las familias latinas del calor extremo. So for those of you who are Spanish speakers, be tolerant of my my attempt, but I really have been practicing saying that because we are very excited that this program, which is directed to Latino communities, is being offered with Spanish translation or Spanish subtitles. So when it launches on July the 26th, please share it with your friends and colleagues and let them know that it will be accessible in Spanish. One of the reasons why we had this program on extreme heat in Latino communities is because what we do at MOMS is that we invite our members and our collaborators to let us know what's important to them. And when we were asking those in the Latino community what would be a program that would be useful, this topic came right to the top about extreme heat. So what do we know about the direct impacts of extreme heat? And again, as I said, we're in this country right now, we are experiencing all across the country extreme heat, that there are heat-related illnesses, air pollution, mental health impacts, adverse birth outcomes, and unfortunately, increased hospitalization and even death related to extreme heat. And there are some concerning food safety issues, very similar to what I mentioned just a short while ago about the issue of heat affecting the effectiveness of certain medications. Again, pregnant women, older people, outdoor workers, athletes, low wealth in neighborhood, low wealth communities without air conditioning are very vulnerable to extreme heat. And in fact, what we're starting to see in some communities is a chief heat officer because of this whole issue of there's so many places within our nation where they traditionally have not needed air conditioning. That's not the case in Atlanta, but there are parts of the country where they haven't traditionally, such as in the Northwest, had air conditioning. And so now that we're experiencing this extreme heat, it really has taken the emergency services systems and the healthcare professionals by surprise in terms of having a strategy for responding to protecting the most vulnerable. Next. Field workers, construction workers, street vendors are common in Latino communities. And in fact, I was surprised to learn that in Los Angeles, 80% of the street workers are women, and many of them are Latino women. So this again is, very concerning when these individuals need to understand how heat is impacting them in terms of being outside during these very hot times. And these are often people who also, unfortunately, don't have access to good health care. So the combination of being sicker because of the heat and the lack of access to health care is a very bad combination. So, and what we want to see and what we are hopeful is, and we're encouraging in the Latino community, is that it's important to be able to communicate with your elected officials and to also to increase the number of people who have the opportunity to vote for elected officials who are going to be mindful of mitigation and adaptation to extreme heat issues and to their communities. And I want to take a moment just to pause and say, there's also a group within Moms Clean Air Force called Ecomadres. And Ecomadres are Latino-focused women who are especially focused on reaching out to the Latino community. And one of the members of our panel that's on the upcoming July 26th panel is Karine Stein, who is a field coordinator like Tracy is in Ohio. She's in Iowa, and she both works with Moms Clean Air Force and Ecomadres. We were also fortunate to have on that panel Dr. Teresa Munoz, who is an obstetrician and gynecologist in California, who has a large Latina population among her patients. And she talked about how heat impacts her patients and how heat impacts any pregnant woman and the kinds of activities that they're discouraged from engaging in when you're pregnant. And our third speaker was Dr. Juan Declet Barreto, who is a PhD and a part of the Union of Concerned Scientists. And he is a social scientist who focuses on vulnerable populations. And they brought a wealth of information to that conversation. So I am shamelessly plugging July 26th. We'll be available on Facebook and YouTube and streaming on those services. So I really encourage you to share that program with your friends and for you to watch it. Next. This is my contact information, and I invite you to contact me. One of the things that we do on is as a part of Moms is that we are very active on social media, not only Twitter, but also Instagram and Facebook, because again, pushing out information, giving information in an accessible way is what we really focus on doing. And also because we believe that moms and people serve as moms, whether you're a biological mom or you're someone's mom by choice, because you're supporting them in that way. We believe that moms are just extremely effective in getting things done. So I am happy to answer questions, and I'm here at your disposal.
Thank you so much, Almeta. And it was such a pleasure to work with you on the Ohio panel. I learned so much that day, and we were so fortunate to have Congresswoman Beatty with us and talking about what's happening at the federal level. So if you haven't had a chance to see it, we would invite you all to watch the recording of that panel. If you have not done so already, we would ask that you put any questions that you might have in the chat, because we're now going to take some time to ask questions of Almeta. I'm going to go ahead and just kick us off here a little bit. Going back to some of the things that you talked about in your presentation, how can we be more effectively spreading this message to those who are, one, most greatly impacted, but also those who have the power to help institute the change that we need to see?
Well, as a member of Moms, one of the very first things that people can do is go to our website. There are plenty of petitions that you can just click a button, automatically populates a communication to your elected official. You don't have to look it up. Sometimes we have phone numbers there for you to call as well. So that's a very low lift that you can just go to our website and you can get started there. You can get involved with Moms Can Air Force at the Ohio level by contacting Tracy, and also just contacting your elected officials. If you call them or email them, that really means a lot to them. When we talk to elected officials and we ask them that question, they say, well, we know that something's important when we hear from people. So that is the very first thing that we can ask you to do. And also being knowledgeable and being informed. We believe at Moms that knowledge is power.
That is absolutely true. So you did talk a little bit about some of the impacts of the increased heat in Atlanta. And I know that we are certainly seeing that in Ohio as well. But what other kinds of impacts do you think we're going to start seeing, in addition to the increased heat, that will have an impact on our health and on health equity issues?
Well, this is an opportunity for me to talk about my other favorite topic, electric school buses. So what we're finding is that particularly the transportation sector is the largest adverse impact on the quality of our air. And we have so many, hundreds of thousands of children riding diesel-powered buses every day. And I'll just personalize this for a moment. And my daughter is now an adult, but when my daughter Elise, I still remember the first day she got on that iconic yellow school bus. She was so excited. I'm a little bit compulsive. I had put a little pin with her name on it and her teacher's name on it, just in case she got lost. She got on the school bus. She was so excited. I had no idea that I was putting my child on a diesel fuel powered bus whose tailpipe pollution is a known carcinogen. I mean, what, you know, as parents, that's just the antithesis of what we want to do. We're trying to send our child to a safe, healthy environment to learn, and we're putting them on a bus that is dangerous for them. I'm very fortunate my child does not have asthma, but if your child does have asthma and you are in a location where you have poor air quality, like we do in Atlanta, there are some days, the orange and red days, where your child shouldn't even be getting on a bus because it's dangerous for them. So I get excited about electric school buses. So for a moment, I forgot what the question was that you asked me. So I started talking about that. Remind me what you wanted me to answer.
No, I think that's actually it's a great way to pull in, you know, sort of what's happening right now in ways that we can have an impact and make a difference on, you know, sort of these climate change impacts. That's the question, you know, talking a little bit about increased heat and other, you know, climate change impacts. What else do you think we're going to start to be seeing in states like Ohio?
Well, one of the things that just reminded me that when we did the program for Ohio, that Ohio moms were focused on the Ohio Energy and Jobs Act. And what I love about that act, and Tracy, you can talk about it in greater detail, but what I love about it is that it's focused on reducing carbon emissions, that it's focused on creating an office of energy and jobs, about energy and jobs, where there's transparency and where there's focus on making sure that people get clean energy, that Ohio electricity comes from sources where they are focused on making sure there are clean energy resources. So Tracy, that's all I really know about the Ohio Energy and Jobs Act, but Tracy, maybe you could just expand on that a bit.
Oh, absolutely. And I appreciate the plug there. For those who may have been with us for the June speaker series, we had our co-lead sponsors, Representatives Weinstein and Juanita Brent, to talk about the Energy Jobs and Justice Act. It's House Bill 429. If anybody's interested in learning more, there's energyjobsandjustice.org. And there is a lot of activity kind of going on today, a little bit in talking about this bill and how it would address the fact that Ohio needs a comprehensive, equitable, clean energy policy that works for all Ohioans. Today is the second anniversary of the arrests that were made in conjunction with House Bill 6. So I think talking about how we can best implement, you know, a comprehensive energy policy and talking about how climate change is impacting health equity, all of this today kind of comes to a head for me that, you know, here we are these years out and we still haven't seen a tremendous amount of change and progress, not the way that we used to. I don't know, Peggy, do you want to take a look at what's going on in the chat and see if we have any questions for Almeta?
Well, at this point, let's see. I do not see any questions. I will tell you that I agree with you on the need for electric transportation. Not everybody can afford electrical vehicles, but we certainly can put mass transit that is electrified out there. And we also had a question. Are you aware of any medium to large cities with electric school buses and what has been done to increase those numbers?
Oh, that question I'm excited to answer. Yes, there are some school districts, particularly in Virginia and Maryland, that are all electric. And right now, we have an amazing opportunity that is an outgrowth of the bipartisan infrastructure law that was passed last year. The EPA has a clean school bus program where school districts can get funding from 2 to 25 electric school buses, and all they have to do is to fill out a one-page application. That's so unlike what we think about in terms of bureaucracy in the federal government. But this program, which the first phase is open until August the 19th, and there are lots of resources for school districts that are on the priority list to help them to be able to make an assessment as to how to best utilize the funds. You have to contact your local electric company to see how to work with them. The funding does allow to also support infrastructure because you have to have a charging station for the bus. But there are companies like, for example, in Georgia, We have a electric school bus manufacturer in Georgia called Bluebird, and they are providing information to every school district in Georgia. And I imagine that there's probably something similar here in Ohio. There's also a national consulting group called Highland that is also trying to help school districts. But collective action and an action at that level of a school district, I have to tell you, I'm really mystified as to why a school district would not take advantage of getting a funded electric school bus on a pilot basis. And because electric school buses admittedly are expensive, but all school buses actually are expensive. So this Clean School Bus Program, this is the first phase of the EPA Clean School Bus Program is this year. August the 19th is the deadline. It's not too late. You can go online, or Tracy, I can get the information to you of some a toolkit to help make sure that people in Ohio know. And in fact, I believe, Tracy, aren't you having a call to action very soon?
We are. In fact, I was just trying to find the fact sheet for Ohio on electric school buses. But on Tuesday of next week, Moms Clean Air Force in Ohio will be joining with our partners at Power Clean Future Ohio, Environmental Law and Policy Center, and also I put dropped a link in the chat to the Power Clean Future Ohio's IGAP program. It's the Infrastructure Grant Assistance Program, where there are some resources to learn, how you can do this in Ohio. We have 611 school districts in Ohio and not one single electric school bus. We have two companies that make electric school buses or component parts for buses in Ohio, and yet we can't drive them on our roads. So it is time to definitely make that switch in Ohio. And with these resources available through the bipartisan infrastructure law, this is the time, definitely the time to do it. So be on the lookout. Visit the Moms Clean Air Force social media platforms on Tuesday so that you can share and retweet and add your stories as well.
Another question from Cleveland, Ohio. And Cleveland and many more Ohio cities, our health departments aren't doing a lot to connect the dots between climate and health and equity. What can be done to push them to help make messaging an action plan, and it's simple for elected officials, the media, and more importantly, the people of the community?
Again, I want to promote the work that Tracy is doing in Ohio and encourage, because departments of public health respond to public officials who provide funding to their departments. And it's kind of connecting the dots. Again, literally, you must reach out to your elected officials and let them know that you want the Department of Public Health to be engaged and to be providing access, information, cooling centers, when it's hot outside for people who need them and who don't have air conditioning. But I know that public health departments, there are many very dedicated employees in these departments who want to do these things, but they can only do so much unless they have the attention, support, and funding from your state officials and your city officials as well. I do know that in Columbus, Ohio, there's a very, I'm blanking on her name, there's a very dynamic director of public health. And I'm sure if you reach out to her, I cannot think of her name right now, but if you reach out to her, I'm sure she's someone who would welcome, support and interest from the public. And there are undoubtedly other similar active folks in the state of Ohio.
Just for general ha-has, I'm a registered nurse, and I'm a member of the Ohio Public Health Association. So what you are saying is absolutely true, that policies are dictated by our elected officials, and we need to put more force on them so that we can get those public health services out there. I do not have any other questions yet. Does anybody have questions for our speaker?
Well, you know me, I can always come up with another question. So Almeta, as you're talking about the panels that you hosted, I'm wondering, looking back over all of them, was there something in particular that really struck you that, you know, hit a nerve or a chord in your heart that maybe you either didn't know before, or once you heard it again was something that has really stuck with you?
I will tell you, I've been very struck by information that I simply didn't know. For example, when Dr. James was giving the detailed, he made a specific like 10 or 15 minute presentation giving information and data about maternal health and the impact on Black maternal health, and the fact that it is there are problems regardless of socioeconomic status. That was really meaningful to me. I learned a lot about Indigenous and tribal communities when I was involved with that panel, just information I simply didn't know until I was exposed to it. And listening to particularly Dr. Juan de Clet-Barreto, who's done a lot of research and talks often with Spanish language media resources, that he really emphasized that collective action is so important. That's something we believe at Moms as well. Sometimes hearing the information from people who are in the community, on the ground, and in that frontline community just makes it more powerful. And I think that's what's really caught my attention, is that when you hear the information from people in these communities, it makes it more real for you. And in fact, another thing that I would say that has been impactful to me is we have on these panels, we have typically had a healthcare professional, a mom, and an expert. And that combination of people, I think, has really worked well, because you see the details, the data in an accessible way, not at a scientific level way, but in a more conversational facts being made available. And then to hear from a mom who personalizes that information, I think has been effective. And I've learned a lot just listening and being able to be a part of those panels.
All right, Almeta, I cannot thank you enough for all of this wonderful information, for helping to, you know, kind of bring it home to us too, for what is happening in Ohio. So I really appreciate your time. And on behalf of everyone here, thank you for being with us today. I am going to pass it over to my colleague on the Ohio Equity team, Chad Stevens, who's going to wrap us up for today.
Thank you so very much again on behalf of the Ohio Equity team. It was a pleasure having you with us and providing such great information. And Tracy, thank you again for asking the questions and being such a great host. It was fantastic. And as well as Dr. Peggy Berry, you are amazing as well. And the rest of the team. This would not happen if it wasn't for the volunteerism of the team to come together and make all of this happen. So with that being said, it is so important that I ask of you all today to just do something really quickly, and hopefully my link actually copies into this like I wanted it to. Please fill out the survey that is in the link. For those of you that are still with us, we had a couple people just drop off, but please fill out the feedback survey, because we need to know that this is what type of programming you would like to see in this series. And we need more dynamic speakers like Ms. Cooper, who was able to bring a lot of good information. And it doesn't happen by happenstance. It happens because we get the feedback from you all. And with that being said, the Ohio Equity team is a part of the Ohio Energy Table, which is a part of the REAMP network. So, excuse me. It is very important that all channels are aligned and on one accord when it comes to this. Well, we thank you again. We appreciate you. And next month, we have another great speaker So please come with the questions, come with the energy, and we are happy to have this one more time. Thank you again, Dr. Cooper, for being with us. Tracy, as always, it's a pleasure. And everyone, have a wonderful, safe weekend. Bye.
Thank you.
Thank you.